I hope you enjoyed our first session and Anulin's yoga session. It was nice to have a stretch, wasn't it? After the emotion from our first session. Now for the next segment, we'll look at the emotional impact of colorectal cancer on patients. We hope to provide you the opportunity to exchange, take some new learning and ideas, and some coping skills and mechanisms that you can use and put in your day-to-day to help manage the roller coaster of emotions. This session, we realize, is focused on the patient side, and I know that we have many caregivers and family members in the audience. So in the next choice of session, remember that we have one that you will be able to select and that address the same topic, but for caregivers and family members. So for now, we'll start with a short presentation by Dr. Mary Jane Esplen. Dr. Esplen is a professor and vice chair of the Department of Psychiatry at the Timothy Faculty of Medicine, which is part of the Toronto University, and she's a psychotherapist. Following Dr. Esplen's presentation, she will be joined by Samantha Megarry, a yoga teacher and theater artist. And Samantha is also a stage 3 colon cancer and Lynch Syndrome patient. She will join Dr. Esplen to discuss the emotional impact on patient and share her experience. Now, let's start. Dr. Esplen, the floor is yours.
Thank you so much, and thank you to the colorectal cancer community. This conference sounds like a great idea, and I'm sure there is a need, and I think it's a really important area. I will give you a bit of background. This is my current role, but for many, many years until July, in fact, I'm still engaged. I worked as a clinician scientist and did a lot of teaching as well. And one of the areas I worked in was colorectal cancer. I worked in breast and colorectal cancer primarily, and I also worked in genetic testing and did a series of studies around coping, around body image, as well as adjustment around individuals going through genetic testing and understanding the impact of genetic testing for colorectal cancer. So it's really my pleasure. I also want to share with you, I've been on both sides of this. I certainly have a practice and see patients and have worked for many, many years in psycho-oncology and a lot of the associations to do with psycho-oncology. But I also had a husband with a colorectal cancer syndrome. He passed away quite a few years ago now, but I have been on both sides. So I understand the health services issues, the need for advocacy by families, how it impacts on the family. In my husband's case, he had an endocrine cancer. There really weren't a lot of treatments at the time. So, most people today do survive cancer for much longer, and he went for quite a long time. But I thought I would just share that with you. I often do. And if anything, it's probably made my research and my clinical expertise even richer. But I'm going to give you some background on what we know from the research, and then I'm going to move into some things that we know are helpful, and then we'll have a chance for some questions as well. Okay, I'm just trying to move my slides. That's reconnection. Okay, here we are. So let me just give you some context. I'm not really going to focus on hereditary cancer as much, but some of the younger colorectal cancers have to do with having a genetic mutation or family history of colorectal cancer. Most of the cancers we talk about in the research world as being kind of sporadic. We don't really know all the causes. You'll hear a little bit at the conference about this, but people are doing research trying to understand what causes a lot of the cancers that we have in our communities. The hereditary and the familial cancers really represent a smaller subgroup of the cancers we see, but a really significant one as well, because there are some unique issues to do with hereditary cancers around coping. Now, when you're diagnosed with cancer, many of you will know, there are a number of stressors that have to do with the diagnosis. And it's really, as you know, life-altering information. That's how I think about it anyway. So there's the physical stressors. You're dealing with the medical illness. You're dealing with biological impacts on your body. You're going to be going through surgery in most cases. the mental and psychological stress, the emotional stress, the stressors on your mind, the cognitive stress. There can be financial challenges for individuals who can't work or don't have benefits. That can impact the entire family, and of course, impact on your family and the relationships. Just getting used to this, trying to. The other additional stressors we're dealing with right now have to do with COVID, and this is really a challenging time for everyone. But I think it is particularly challenging around individuals dealing with a cancer right now in the family, because you have fears around like everyone, around the exposure to COVID and the virus. There are communication needs to understand, well, what's all happening? What's happening with my treatments? Can I outreach to my health professionals? Where is this going to go? When this is going to end? A lot of concerns and confusion around treatments or follow-up care. There are fears about the well-being of loved ones being isolated. So I have another number of patients actually who really want to be seeing family and friends, and they're isolated. They can't go out. We're in a lockdown in Toronto right now, so they're not able to use their natural social supports and regular uses of social support or other resources, or seeing family. It's really hard on everybody. And then also for those of you who are dealing with a cancer or palliative care time, or even if you've had cancer but you have other family members or loved ones that are diagnosed with COVID or other illnesses, we're at a time where we can't even be around our loved ones at the point of dying. And so there can't be funerals or a lot of rituals that are really helpful to us at this stage of our lives, and we can't engage in them. Now, I just want to do a brief definition of cancer survivorship because it's pretty broad. Survivorship definitions include right at the time of diagnosis, right to the end of life. And I'm going to show you some statistics from the cancer survivor literature. Not everybody likes the term survivor because individuals often say, well, I didn't ask to be put in this position. I don't necessarily feel like a survivor. It's just a term in the literature. It's a term in our clinical area. But I wanted to help you understand that when we see research in this area or talk about cancer survivorship, it's really a broad range of time. Sorry, I'm just getting used to this, trying to do my own slides. Now, these are the most common issues that we have noted in the literature. So one of the most common symptoms are fatigue. And I know you would know this. There are things we know about dealing with fatigue. One of the major helpful strategies is walking or any form of exercise. Not even just about the amount. Exercise, and it sounds counterintuitive, is one of the best things we can do to help with fatigue. But there are other symptoms: changes in sexual functioning, changes in memory, concentration. Nervous system problems are really getting at the coping and the anxiety and stress problems, anxiety, and then changes in body image, which is an area where I worked with. For the younger survivors, individuals who have cancer at a younger age, most report overall physically and emotionally they feel pretty good or very good. But they have issues and challenges too around anxiety, including also depression, and 61% reported easy to cope with in terms of day-to-day in general. Depending on when you asked individuals and their family members around this question, because we know there are more stressful periods, like at the time of active treatment or at the time when treatment just ends. 44% reported finding it easy to share their worries or concerns with others. But, that tells us about 60% find it difficult to talk about these issues. In the area of emotional concerns, this is again from looking at younger adults, there can be a loss of interest in daily activities, symptoms of depression and sadness. In fact, I would say most patients going through the cancer experience have symptoms of depression or anxiety, maybe not at a stage where they require medication, but will have depressive symptoms along the way. And that would be really part of the normal adjustment. I mean, it is negative news. It can help lead to individuals feeling sad and distressed. Anxiety, stress, and fear recurrence are quite common. You can see rates as high as 84%. And again, changes in body image, which is interesting because we don't even ask a lot about body image of our patients when they're going through the cancer experiences. This is something that we're changing, but often nurses and doctors don't check in too much on that area when you're coming from your follow-up appointments. Physical concerns include the fatigue and tiredness again, menopause. Many patients will go into premature menopause as a result of chemotherapy. Fertility is also an issue, but changes too have been reported around concentration and memory and sexual functioning. Again, and we're going to come back to some of that. Cancer has an impact on the whole family. So if you have a partner or spouse, there can also be changes in their coping, including worry, feelings of feeling isolated, people not understanding how they feel. There also can be positive effects, in fact, bringing couples closer together. But I will say that there have been studies that have shown that on the partners, sometimes the stress level is even higher than on the patient. It's really hard for some of them to know what to do, how to help support coping, how to help their partner go through the experience, and how to even communicate about it. So it really has an impact on the whole family, including children. And these are some of the areas that we know impact children. So a sense of uncertainty. They know things are going on in families. And sometimes families try to not tell the children too much or even hide everything from the children, which is really difficult to do. And I will tell you that children have a way of kind of figuring out something's going on. But these are the changes we see. They have an awareness of the changes. There can be disruption, of course, in the family routines and patterns. Increased or changes in roles. So maybe a female caregiver, now that those roles are taken over by a male partner or the father in the family. Or others are being brought in to help with family roles, like a grandparent. Changes in caregivers in the child care, and also losses in terms of having contact, regular contact with a parent. The parent maybe hospitalizes, or changes with intimacy around with the parent. Now, we also asked about areas of unmet needs, and every hospital should have a psycho-oncology department. Some of them are getting smaller with budget cuts, and if you're in a rural community, maybe harder, but just having access to a mental health professional can be very important, and your family doctor or your psycho-oncology department can help, and you can ask your medical doctor or your nurses about this. But we do have areas of unmet needs, so you'll be interested to see that 78% say their emotional concerns are not necessarily taken care of. Physical concerns or the residual impacts, like I always say, everything we do to treat cancer, surgery, chemotherapy, hormonal treatments, radiation, everything we do impacts the body and the person. That's how I think about it. And people want treatments, but most treatments leave some sort of residual impacts that will be for a long period of time. There are practical concerns like, how do I return to work? How do I want to return to work in the same way? What can be done to that? How do I do the tasks that I used to do? So at least 84% report at least one area of an unmet need. And this, I believe, was a Canadian study. Age, sex, where you live, your income, your location. There are a number of factors, language barriers that may play a role in who in particular feels an area of unmet need. Just trying to move my slide. Okay, so stressors during transitions. I have this slide just to show you that, in case you didn't realize this, if you've gone through this, you will recognize this. You know, individuals have unexpected periods of distress that are going through cancer. For example, you would think when the treatment ends, you're going to feel great. And I think for the most part, people do. I got through that, I survived, I went through, the treatments are pretty horrific in many cases. But people don't anticipate that when you're told, oh, you don't have to come back for 3 or 4 or 6 months, a period of feeling worry or concern or even sadness. And this has to do with the transition. This is a time of confusion. There can be an experience of loss. I mean, when you're in the active treatment period, you're around health professionals and nurses and doctors and the team. You feel like people are rallying around you, and that can all of a sudden dissipate and leave the patient or the family member with a period of really confusion and a sense of loss. And this can result in a need for psychological adaptation and adjustment. So there can be feelings of being abandoned, feeling all of a sudden unsupported, confused, And it's unexpected. People don't expect to really feel quite this way. So here's some quotes from patients. A friend came over to see how this woman's doing. She told her friend that she has had daily crying spells about her changes in her body. And I would tell you, I work a lot in body image. And the body image issues, although they come up during the active treatment period, they particularly come up after the treatment settled down, all the treatment phase, because you're kind of left with the changes. And I think sometimes people think, well, I'll get back to kind of normal of who I am, or my body may readjust. In some cases, depending on the surgery, it won't be the same. You're dealing with new ways of functioning. So that requires a period of adjustment. Here's some other quotes. I'm here to find out about anything that will give me a sense of control. I worry that cancer will return. This is very common experience. And also one of the reasons people go through genetic testing, because they really feel worried about all these cancers sometimes that have been experienced in the family. And genetic testing is life-altering information too. So if you're at high risk for cancer and then you find out you carry a genetic mutation, that can lead to quite a lot of anxiety and some distress as well, because you have to go into active screening and surveillance. And, there is that sense like you could feel like a little bit of a walking time bomb, because you've had that whole experience maybe of a lot of loss or a lot of cancers in the family. Sense of aloneness. I think a lot of this gets processed alone, that people feel, I don't think anybody really understands what I'm going through. It's hard to talk about in some situations and in some families and in some cultures. No one understands how I feel sort of isolated. Now, one of the things that's often not talked about in the clinics, but I've been doing research on and did a number of kind of psychometric measurement tools to help us measure the impact on self-concept. This is really to do with our self-esteem and who we are as a person. So when you've been dealt with a life-altering illness, there's an existential kind of impact. It's life-threatening. I mean, there's that sense of, you're going on in life, and all of a sudden, a sense of continuity of self can be feeling interrupted. You may think about your future health in a different way. It may cause some anxiety. And your sense of what's important to you, your priorities, your values, how you view yourself as a person, maybe what's important to you now. For example, is work as important as it once was? You may look at your relationships from a certain point of view. What's important to me? Who's important to me now? That can shift. And that can be kind of distressing and a real sense of change on individuals around you as well as the person. And I see these as kind of an existential impact around the shifts in identity. One of the areas of identity, again, is our sexual functioning and our body image. So if you're a young man with cancer, it's going to pose questions for you about intimacy in the future. How will my partner experience this? How will they view me? Am I still a sexual functioning person? Will everything work in the same way? And there can be lots of feelings around rejection. So again, this is about loss, changes to yourself, changes to your body. They can be processed through, but it's normal to feel sadness or sense of grief or a sense of anger along the way. So what can we do? How do we support individuals going through this? What are some things that you can do? So I think about coping tasks from about 4 areas. So there's the mental health and the emotional functioning. There's the physical functioning. There's the interpersonal relationships. So our loved ones, our partners, our family members, our children, our parents, our friends, and then our life perspective. So first of all, it's really helpful for you to know that a lot of the experiences you are having are completely normal. It's very reassuring, someone told me, to know I'm not the only one feeling these things. It gives me credibility that this is only natural. I do a lot of group psychotherapy. I do a lot of support groups for colorectal cancer and breast cancer. And one of the reasons I love to do groups, I can share what other patients say and feel, but to really hear it directly really can decrease that sense of aloneness, which is a very, very common feeling. Sorry, just moved my slide. So this may not show up quite as well as I thought, but areas that will be impacted: your confidence, the social support, adaptability, and purposefulness. So I have this to show these are areas where you can foster resilience. So for example, there are things you can do around confidence, looking at your attitudes, trying to instill, to some degree, positive and adaptive coping. That doesn't mean negative thoughts aren't going to come in. They're also important to recognize and to feel, but to moving towards, okay, so what can I do? Where can I get control? Where can I still have confidence? This has shattered my confidence in this area, but where do I still feel some confidence? Where are my strengths? Where can I get help on something? And information, for example, is one area, because that will give you a decrease of uncertainty around information and confusion, and that can help you with confidence. Social support. So this has to do with our supports, our loved ones, our friends, our work relationships, learning how to talk with people openly, trying to share where you feel safe, even if you don't have the language. And people feel often helpless. They don't know what to say. Like our loved ones around us may not know what to say to somebody with cancer, but one of the things you can say is they don't have to have all the answers. They can just listen. They don't have to fix everything. Just talking about it can be helpful in itself. But there are other ways to find social support groups, agencies like this agency, wellness groups, Wellspring, Gilda's Club in Toronto is a source. And a lot of these mechanisms now are offering virtual supports, because we know that social support, when you're going through a cancer diagnosis or any kind of life stressor, is a buffer. It is very helpful to coping and adaptation. Now, the circle at the bottom, adaptability, has to do with coping and having more than one way to cope and having flexibility. So maybe for you, your coping mechanism is always about getting information or being in control. And this is an area where you can't be maybe in control of everything. So finding some other ways to cope. So sharing information, receiving support, learning about mindfulness and relaxation training to give you more tools around coping. If you're someone who self-medicates, so uses alcohol or drugs or workaholism even as a source of self-medication, finding other ways that are healthier. I mean, those things can turn off negative emotions, but over the long term are not going to be overly helpful. So finding ways, reaching out to your psycho-oncology team, finding a mental health professional, ways to increase and broaden your coping skill set. And then purposefulness. Well, I'll tell you, one of the things that help patients is giving back. Like I know altruistic strategies and talking to other patients and helping others can make people feel a lot better about their situation. Trying to find meaning in the event. Now, for some individuals, this gets into the area of spirituality. Not that, there's nothing you did that caused cancer, but trying to understand, is there anything you're learning from the experience? Or kind of not necessarily a positive reappraisal per se, but what is this teaching me? What am I gaining from this, if anything? How can I give back? Is there any meaning in going through something so tough like this? That actually can be very, very helpful to us as we go through a tough situation. Just trying to change my slide there. So strengthening resilience has to do with being prepared psychologically. We need to do better to give information to our patients and families in a very tailored way so that they understand it and comprehend and can follow through on recommendations. Having emotional insight into what you're experiencing. Areas like spirituality, anything that helps you with coping are very beneficial. Life balance, thinking about your work, thinking about what you need, taking care of yourself, personal reflection. So anything you can do that really helps you reflect on what you're going through and helping those around you do the same. And anything that helps you with that sense of continuity as you go on. Who am I still? What did the cancer not take away? Or what is the cancer bringing into my life as well that I'm learning about? Or what are my new values and sense of self? Now, in terms of strategies and programs, cognitive behavioral therapy has been shown, whether it's in person or telephone or now virtually or online, all have been shown to help with anxiety and depressive symptoms and also fear of recurrence. CBT in conjunction with physical exercise has also been shown to be really helpful. And you don't have to be doing everybody aerobics. It can be walking with a friend, listening to a tape as you walk. Any kind of movement can be helpful. Self-help and reading websites to a point without getting yourself too overwhelmed. So self-management techniques, and there are a lot of self-management techniques around coping or reading or strategies to take care of your wellness. Stress reduction and mindfulness-based training. So mindfulness, meditation, relaxation, all of these have been studied in randomized controlled trial, and every one of them works on sleep, depression, anxiety, and distress. Support groups. I'm a big proponent of support groups, and I know people are fearful of them. Oh, I'm going to open up the issues, or support groups breed misery and company of others going through this. Not necessarily true. I'm a fan of therapist-led support groups because they are trained in working through the types of tough emotions that come up, and they come up: loss, grief, anger, asking yourself why you got cancer, all those things that come to your mind that maybe there's no other safe place to talk about. Therapist groups or even one-to-one therapy are just so helpful to work through really challenging emotions. And I will say, depending on the situation and where they ask you going through the cancer trajectory, somewhere between 25 to 50% of patients will require professionally led support models of either one-to-one counseling or therapy or something like a group program. Couple counseling also has been demonstrated to be very helpful through randomized controlled trials to help couples work through issues as a result of having cancer. So communication issues, dealing with body image and sexual functioning, there are individuals that you can find that are trained to help people going through this. And if they're not even trained in the cancer experience or working with a cancer clinic, even in your community, reaching out and asking your family doctor for a referral to a couple counselor can be helpful. Same with in the area of children. There are family therapists that are trained to work with children and families that are going through a life-threatening illness and the experience of adaptation around this. Now, in some cases, being open to medication is really important. We know that medication, even in the short term, can be helpful with sleep or mood and really high levels of distress in the area of depression or anxiety. And they may not have to be forever, but they can be very helpful. So again, seeing a psychiatrist or getting a referral to a specialist. Just trying to, connection lost. Trying to change my slide using my, it's not changing my slide, so I don't know, maybe you can move to the next slide. Thank you. I'll just have you move now. So physical exercise and wellness, there have been countless studies, randomized trials, that eating healthy, exercise, again, it can be walking, it can be bicycle, it can be aerobics, it can be a little bit of weight and strength, all of it helps. It's not just about the amount, but it gives you a sense of control and wellness, and it will help build strength and resilience. Next slide. I think this is working better. How do we make movement more meaning in what we're going through? So again, seeking wisdom over we're very focused on survival in our cancer treatment programs. And I think that's very important, of course, but really talking about it and what's this all about and understanding what's happening to us when we go through something so extreme as a cancer diagnosis and its treatment. Anything that helps us see a bigger picture and move beyond what's happening just at a more, minuscule level, finding real and special moments. Often people will talk about having time with loved ones and certain conversations that came forward during their treatments or their experiences, a time for humbleness and humility, and then the whole area of social support and human connection and the closeness that can come forward. Next slide. Education and self-management strategies. There are websites. There's a lot of virtual care. You can get CBT now with therapists virtually. There are sometimes online decisional aids if you have decisions to make around treatments or genetic testing, for example. There are pamphlets and there are coaches and life and health behaviors. They're all helpful. Those are things you can do more from a self-management point of view. Next slide. And then returning to work. I think on my list at the end, return to work, there's a very helpful return to work website because this is a challenging area. And we've been really working with employers to help them understand that people may come out of the cancer experience feeling differently. They may supports. They may need supports as they return to work, different workloads or different work settings. They may need time to come back to work. So we're working with employers and we're working with families, but there is a website, Return to Work, specifically for cancer and the experiences around cancer, and has a lot of useful tools. And I think I put it at the last slide on the resources. Next slide. Again, I don't feel I need a support group. This man's saying, I've had cancer, but I have a very strong desire to help others who are at risk. I'd like to help. You know, this is one of the areas after you've been through the treatments and so forth, people find this really, really helpful. Sometimes they become a volunteer or they're a peer support person. This is an area where you can help derive meaning, but it's really helpful for your own adaptation to dealing with something so tough. Next slide. Useful questions to ask yourself. So how will I maintain my confidence? Or I put our because of family to restore it when it dips. And it is going to dip. You're not going to have every day feeling entirely as confident as you did prior to maybe having cancer. Where will I reach out for social support? Think about your networks. Look around. Who could be beneficial? Who in your loved one situation or friendships might be helpful? Sometimes it's a friend more than it's a family member. And if you don't have that, where can I find more formal networks? A group program, a wellness program, maybe a professional. How will I ensure that I remain adaptable? So am I using one type of coping? Do I just mainly cry a lot? So that's an emotional form of coping. Or do I use alcohol? Or do I smoke a lot? Do I talk to others? Like trying to figure out where you can build more in your bank of coping strategies, because there are all kinds of different ways to strategize and cope. How can I maintain my focus during treatment and recovery? And how do I adapt as I go through a new transition? Well, let me tell you, every time you go through a different stage, it will be very helpful just to anticipate that you're going to change emotionally, and that's completely normal and adaptable, that you're going to maybe feel a sense of loss or a sense of sadness or a sense of change. And then how can my social network and family support, how can we help each other as we go through this time? And that involves a lot around communication. And if there are challenges in their family, there are professionals that can help guide some of those communications. Next slide. This is where you want to get. And I often show this around the group therapy programs I've run. One of the things that often comes out of this, I experienced it, and certainly my husband and I were able to really use our time well. And we're really clear about our priorities and what was important in our time and what we wanted to do, but also getting to a place where you don't take life for granted. I wouldn't say it's just a silver lining. There's not really anything too positive about having cancer. People don't like that statement. But when you go through something that is so challenging, we often do find unexpected reactions and something that helps us go forward. And these are the areas that life is really valuable. These are the existential kinds of impacts that will help carry you forward. And then I think my next slide, please. This is the final slide. I think they'll make this open to you. These are some websites. There's a Cancer and Work one. Cancer Chat Canada. I used to run the D'Souza Institute. I built the D'Souza Institute, and we run Cancer Chat Canada, which is a series of free support groups, therapist-led. They're text-based, but open to anybody in Canada. And we have groups on coping and fear of recurrence and groups on fatigue. We do a number of them. So that's something you may want to check out. CAMH, the Centre for Addiction of Health, a lot of these are virtual now. Canadian Cancer Society has a number of supports, and Virtual Hospice has some excellent tools and support around grief and managing grief and loss, and mygrief.ca. I put that there as well. So I'm going to finish off there. Again, it is a pleasure to do this presentation and use some of the resources, and I hope that it's been helpful. And it is a very challenging thing to go through, but people do build supports, they are resilient, and people come through incredible suffering. So thank you so much for the invite. All the best.
Thank you so much, Dr. Esplen. I really like the coping domains and how you look at and build resiliency, which is certainly a life skill. So thank you so much for all the information. Now, I'd like to welcome Samantha Megarry to the discussion. Sam, first of all, thank you for joining us. And may I ask you to introduce yourself and share your story with the audience?
Absolutely. Thank you. My name is Sam Megarry, and I am a yoga teacher and a theater artist. I have no background whatsoever in science or medicine, but I am a stage 3 colon cancer patient and a Lynch Syndrome patient. And so I always like to joke that I have, many medical degrees in being a patient, because as many of you may know, very quickly we become experts. And so exactly 2 years ago now, when I was 28 years old, I was diagnosed with stage 3 colon cancer. I had surgery. I did 6 months of chemotherapy. And when I was diagnosed, of course, it's unlikely in your 20s, I didn't know that I had Lynch syndrome. So this genetic element that we talk about, I didn't know that I was at a certain risk. I didn't know that I should be having certain screening done even in my 20s. And so I was, mistakenly diagnosed with IBS for a very long time. I was told my belly pain was probably stress, change your diet. I did lots and lots of things for about 8 to 10 years before I finally wound up in the emergency department with pain that I couldn't push through any longer. And so I had surgery, I went through chemo, and as we've just heard, the emotional impact, I would say, is equal to the physical impact in my experience. Keeping in mind, this is all in my experience. I'm one patient, I'm just me. You might have a totally different understanding. For me, when I was diagnosed, it was shocking. It was scary. It was overwhelming. I often felt sort of out of my body, as though I was watching this thing happen to me. But it was also like a really busy time. So right away, tons of appointments, tests. For me, I don't have an employer. I had many different contracts. So I had to make a lot of phone calls, canceling gigs, helping to find replacements for myself for artistic projects. I was on the phone. I was making trips to the pharmacy. I was trying to make decisions about which chemotherapy and fertility preservation and things I'd never really thought about before at the age of 28. And so it was busy. It was hectic. And then all of a sudden, all of that stopped. And it was just me. And I was however many cycles through chemo when things sort of got quiet. And that is when the emotional part, I think, starts. And so for me, movement was a huge coping mechanism. I was an athlete before I got cancer. And so throughout treatment, on my good days, I was running. On my bad days, I was, doing circles with my wrists and wiggling my toes and walking around my 1-bedroom apartment. The biggest advice I always give to folks who are about to go through this is that whatever folks say is a coping mechanism for cancer, you're allowed to say, no, thank you, not for me. So for me, movement, huge. For me, crying, huge, really good for me. But things like yoga and meditation, which I teach, I'm a yoga teacher. I love this stuff. When I was in treatment, I didn't need that. I didn't need to slow down and be quiet and listen to my breath. I needed like loud rap music full of profanity. I needed lifting heavy weights and running when I could. I needed noise and action. And so, if you feel that, if someone has offered you a gentle yoga practice and you're like, no, I just want to blast this loud song I love to dance to and just listen to it, do that. The other thing I'll say is that, as we just heard in that beautiful presentation, the emotional effects of cancer treatment do not end with cancer treatment. In fact, in my experience, they really started after cancer treatment. When you're in treatment, you are a full-time patient. You've got people checking in on you. You've always got somewhere to go, something to do, various things to keep your physical body going. And when all of that ended for me, that is when the adrenaline left and everyone around me was saying, it's over, let's celebrate. And it was like the dust had settled on what had happened to my body. I felt like time had frozen in those 9-10 months of treatment. And so after treatment is when I got serious about seeking professional help. I found a wonderful therapist who this is her specialty. And so now, I mean, we're 2 years post-diagnosis now. I don't consider myself done. I don't consider myself healed from that experience, though I'm physically much, much better, and I'm very grateful for that. And so, yeah, that was my roundabout story. Yeah, my biggest advice is try everything and then leave the things that don't work for you. It's such a joy to be here today, and I hope you enjoy the rest of the conference. Thank you.
So I'm going to, I thought I've met Sam on the phone, Samantha on the phone. I have the first time. It's really nice to see you in person. And thank you for sharing that. I kind of wanted to kind of highlight a couple of things that you said that really reinforced something. In fact, one of them I didn't really pull out enough, I think. I really love the fact that you underlined the individuality. And first of all, I'm really sorry to have to, I mean, none of us, when you see someone as young as, and I'm sure you got that all the time, the young patients get this in the clinic. You look so young, you're so young. So you see, there's such an age range, and you see this in the genetics area. You can see young patients, and then you have young people also going through genetic testing. And I know most of the patients say, they don't want to hear they're young. And they're often in clinics, with older patients. It's one of the things, if they're going through chemotherapy or surgery, they're often sitting in waiting rooms with older patients, which I think contributes maybe to further isolation. But one of the things I think you really underlined was how individual it is, and that it's okay working with the nurses or yourself, understanding what you think you need. I gave an overview of different things, and she said crying helped her. And crying does help. It's emotion-focused coping. It does help us. And so you needed that. Movement was really key for you. Like, that's what you needed. You already knew about meditation. You wanted to physically deal with this. You wanted a physical way to help deal with some of the stress and manage the anxiety and some of the other symptoms, and probably lots of thoughts that were going on. I can see in your story you really experienced one of the things that I think we don't talk a lot about and prepare patients for, that when all that busyness stops, everybody around you at home thinks, oh, good, you're done the treatment. Everything's going to go back to normal, or you're going to feel better. But you see, Samantha said, that's when the emotional stuff came up more even. And I find too, areas like sexual functioning, body image, yes, depression, lots of things start to come up when the noise all settles down. And you often do think, I'm going to get back on track now. Or maybe your partner says, you're going to get back on track. Maybe people say, well, I expect you to get back to normal now because it's all over. I think about this as life-altering information. And so people will often say who I was in life before cancer and life after cancer. And you will go on and adjust, and there's a continuity. But as Samantha just pointed out, I'm 2 years out. I'm still working through some things. The other thing is, I love that idea of time freezing. I didn't mention anything about that, how it just feels like time froze for a while as you dealt with that. And then the whole, getting... you're really brave and also very forthcoming around telling us that you wanted to see someone. You had lots working for you well, the movement and the dance and all that, but you still wanted to talk to someone. And lucky you found someone who works in the area. So that would have felt probably more aligned and really understood the issues, but someone more neutral than your family or loved ones to work through some of the the feelings that you must have been having at the time and working through this.
Yeah, I think part of my impulse to seek professional help was for my husband. I didn't want my husband to be my professional help. As you mentioned, this is hard for family members and caregivers just as much, if not more. And so I wanted to outsource that so that my mental health wasn't 100% on him.
Yeah, I think, and I'll tell you my experience of partners. So they're going through this too, and they want to help, and sometimes they don't know how to help. So sometimes we tell the person who has the cancer, it might be helpful to be as concrete as you can for things they could do. They don't have to fix everything. Like, they can feel actually quite helpless. So bringing them into the situation is good, but they can't do maybe everything. And maybe in your case, you're saying, I wanted somebody apart from him to also have a place for me to openly share everything and not, it sounds like you might have been worried of burdening him or wanting to take care of him too emotionally, somewhat. Not, I don't know, what was your thinking around that? Or
yes, we do our own work as a couple working through this, but he's not a mental health professional. So he can help me because he knows me and loves me, but this actually isn't his area of expertise, right? And there are people who this is their area of expertise. And for me, something that's been really helpful, there are no feelings or thoughts that are off limits for me. This concept of like, just think positive and like, no, don't think about that. That has never been helpful for me from an anxiety standpoint. And so having a therapist who allows me to talk worst case scenario and to feel rage even 2 years after diagnosis, for me, is therapeutic and helpful.
That's really great that you mentioned the positive comment one. We hear this a lot. There are lots of books out there to think positive. The reality is you can't think positive all the time. And, we do know from research as well, when individuals have felt pressure around them, they always have to be positive or look at going forward in their futures. What it does to the family of the individual going through this, it closes them down to be able to share the more difficult emotions. You just mentioned some anger and rage, and even it comes later. It comes early, it comes later, it may come 5 years later too. You're a young woman when you go to have children and all the things that may be ahead of you down the road, lots of things are going to come up about all this. So it's not natural to think positive all the time, but there is a lot of pressure. There are a lot of pressure with those around us to keep your chin up. Don't think negative. You might make the cancer worse. Or don't be negative. The cancer might come back if you got through it. There's no evidence for any of that. In fact, what we do know, what there is evidence, it's more isolating. It contributes to feelings of shutting down and aloneness and actually can result in further depression. So what you want to do is be open to the whole range of emotional reactions, and they're all valid. Anger, sadness, stress and anxiety, worry, fear of recurrence. What you want to watch is track it, because some of them will just in time. But when you see that the fear occurrence, it's intruding every day. Like, I go to work now, I'm 2 years out, I'm 3 years out, I go to work, I'm still, it's interrupting my enjoyment of life, or I'm not as depressed, I'm not functioning like I want to be. Those are times to start seeking more professional help or a support group or something else, because it's getting in the way now of your quality of life when you want to be trying to move on in your survivorship. So yes, thank you for mentioning that.
And something I think folks who are very well-meaning by saying, that's over now and you can move on, what they don't necessarily understand is the nature of cancer follow-up won't let you do that. So like, if you're still having a scan every 6 months in a Lynch Syndrome scenario, I've got lots of organs that are being watched every year for the rest of my life. And so this concept of like, forget about it isn't possible. My therapist has this amazing image of like you're in a car and the cancer, Lynch syndrome, whatever it is, will always be in the car with you, but like, can it be in the trunk next week? And then, when you go for your CT, it might have to be in the front seat, but being able to carry that with you without ever letting it drive the car, and being able to put it, back so that it's not always at the forefront.
Yeah, so you're able to not have it intrude quite as much, but you're recognizing in the way that's a great metaphor, actually. I mean, you're able to, this is life after cancer for you. This is part of your life. In fact, I worked a lot in genetic testing. And so the young women with breast cancer gene mutations and the young family members with colorectal gene mutations, they are in screening for the rest of their life. And, it's very normal when you're coming into those scans or colonoscopies, some anxiety will start to go up, and then until you get the result, it might go back down. So this is just part of your life trajectory now. And, patients can feel quite medicalized. They're healthy. Like in your case, you've had the disease and you've been working through that and had to deal with that. And then there's individuals who don't have the disease but think they might get the disease, and they can feel quite medicalized too. It's part of their life. They're around clinics, they're in hospitals, they're going for routine exams. So I think you have a really interesting way to look at it, where you're able to live life fully and enjoy lots of aspects of your life, but you recognize this is part of my continuity of the self. Like, I will be carrying this forward, but I have a handle on it. It's in its place. I know I have to do it. I'm not going to be so nervous I don't go, because that can happen. People can have such high anxiety, they actually don't want to go for a mammogram, or they don't want to go for a colonoscopy. And colonoscopies bring a lot of feelings for people. It feels intrusive. People can feel embarrassed. They may be afraid what they find. Like, there are individuals that won't go for screening tests because they're so distressed or so fearful. And that's another reason to try to seek some professional help, because there are ways we can help individuals get that anxiety and fear down enough that they can follow through on what they need to do to take good care of themselves. But you have a good handle. Like, you're demonstrating what we would call active coping. You're not in denial. You've been working through it, and you've used a variety, like, come back to that flexibility and then adaptability. You've used more than one strategy: exercise, counselor, talking to your husband, dance. You've been working on your cognitions. You're not afraid to talk about emotional negative experiences, and you allowed yourself to cry. That is a whole lot in that bucket of different coping. And so you would have flexibility. We would say there's somebody with adaptability and flexibility in the coping strategies, not relying on one type of strategy.
Thank you. I appreciate someone who is a professional.
A lot, and it's hard. The other thing I didn't come back to, it happens with young individuals. You said they thought you had IBS. My husband went through that too. They thought he had IBS. He was older than you. For many years, they treated him for IBS. He had a very rare cancer. So that really speaks, and it happens. And it happens on young individuals because, we're not as primed as we should be that young people can get cancer. And people don't have their head set there. But it does underline the need for advocacy, and not, if you think you're having symptoms and it's not working out, seeking professional help to understand what you're going through in the symptoms. It can happen. A delayed or as you're going through those tests, getting yourself diagnosed. I didn't really say anything about it, and it can happen. Colorectal cancer too, by the way, I'm sure you hear this over and over again. Often it's there before the symptoms. That's why colonoscopy is so important. And I did a randomized trial not too long ago on comparing telephone to one-to-one to just getting a letter on going for colonoscopies. And in Canada, we still don't have rates as high as we'd like, nor in the US. People are nervous about colonoscopies. They think, I have to wait. I don't have any bleeding or symptoms yet. But that's not the way it is with colorectal cancer. Often you can detect a cancer early if you go for screening. And it's one of the best screening areas we have are the surveillance around colorectal cancer. It's one of the best. The screening is really good. And yet people don't always go when recommended. It's very common that they sometimes don't. So you
Yeah,
sound like
I
you
mean,
you go for
none of
follow-up.
these medical tests are fun. I mean, yeah, for me, I can't imagine a world I go because of fear or shame, because for me, it feels active. It feels like putting in the work to keep this body going as long as humanly possible. And I have had colonoscopies where we've found polyps since then, and there's no better feeling than getting those things out of there. So yeah.
Anyway, I think we're at the end. I really enjoyed meeting you, and I want to thank you. One of the things that was like is to have someone so open about sharing all the different things you did and how hard some things were, and then to see how well you're doing is very, I think, provides a sense of optimism too to individuals. But I want to just really thank you for sharing, and I hope everything works out. I'm sorry that you had to go through any of this, but you sound like you're in really good hands and that you've got a team around you and a supportive spouse. So those are all variables that will bode well as you go on. Thank you to the organizers. Thank you for bringing us together and allowing this type of presentation for others to learn and benefit. All the best.
That was an emotional session. I just love the way Sam expressed, so inspiring to see how she was able to express her story with all the analogy and just an amazing discussion. So very helpful. So with that in mind, now for the next segment, you're going to have the opportunity to choose your journey and select from 4 different sessions. These 4 sessions will run at the same time, so simultaneously. To join the session, you can select by, you're going to have 4 buttons. You can select them by clicking on the session that you'd like to attend. You're going to have, in fact, 8 buttons, so 4 in English, 4 in French, and you can just kind of select it by looking at the title on each of the button to be able to select it. We're going to have, before that, a short break. And the session will start again at 3:10 sharp. So I would ask everyone to be back for the next session, so we can all start on time to continue the journey and go to those different sessions, the 4 sessions where you're going to have the ability to select and be able to answer also your question throughout the panel discussions. Thank you.